Imagine if a tiny molecule in your blood could quietly threaten your brain, causing confusion, seizures, or even coma. This invisible danger is ammonia, and monitoring its levels can be the key to protecting your health, especially when your liver or kidneys are struggling. Today, discover why the ammonia levels test is essential, how it's performed, and what it could reveal about your body's hidden workings. Ammonia, scientifically known as NH3, is a normal waste product created in your intestines when bacteria break down protein from the foods you eat. Under healthy circumstances, your liver transforms ammonia into urea, a much safer compound, and your kidneys eliminate urea through urine. This vital process is called the urea cycle. As long as this cycle functions smoothly, ammonia never builds up to dangerous levels in your blood. But when something goes wrong, if your liver or kidneys are damaged, or if you have certain genetic conditions, ammonia can accumulate, posing grave risks to your brain and overall health. The ammonia levels test measures the concentration of ammonia in a sample of your blood. While it's a simple laboratory test, its results can be life-saving. Doctors most often use this test to help diagnose high ammonia levels in people who show concerning symptoms. However, the test is rarely used alone. It's typically combined with other medical investigations to pinpoint the underlying problem. What makes ammonia so dangerous? Even small increases in blood ammonia are toxic to the brain. Elevated levels can cause permanent brain damage, lead to coma, and in severe cases, result in death. The most common reason for high ammonia levels is liver disease, which prevents the liver from efficiently converting ammonia into urea. Other causes include kidney failure and rare genetic disorders called urea cycle disorders, UCDs, where specific enzymes needed for the urea cycle are missing or malfunctioning. Doctors may order an ammonia levels test for several reasons. The most urgent is when a patient shows symptoms that could be due to excessive ammonia in the blood. These symptoms vary depending on age and the amount of ammonia present. In adults and children, signs can include irritability, lethargy, confusion, headaches, vomiting, loss of muscle coordination, behavioral changes, mood swings, and seizures. Confusion may be so severe that a person loses awareness of their surroundings or can't recognize people and places. In children, additional symptoms can include poor growth, limp muscles, developmental delays, and in newborns, rapid breathing or grunting sounds. Certain medical conditions especially warrant ammonia level testing. One is hepatic encephalopathy, a serious situation where toxins, including ammonia, build up in the brain because the liver cannot break them down. Symptoms may range from mild confusion to complete loss of consciousness and coma. Another is Reye syndrome, a rare but life-threatening disorder that damages the brain and liver, most often affecting children under 15, who've recently had a viral infection accompanied by fever. Urea cycle disorders, genetic conditions passed down from parents, can also be detected by ammonia level testing, especially in newborns, as part of routine screening. But the ammonia levels test isn't just for diagnosis. It also plays a crucial role in monitoring patients with ongoing conditions that cause high ammonia levels. Doctors use it to check if treatments are working and whether ammonia is being kept in check. For those with a family history of urea cycle disorders, the test may be recommended even if there are no present symptoms, as early detection can prevent serious complications. How is the ammonia levels test performed? In most cases, a healthcare professional draws a blood sample from a vein in your arm. The procedure is quick, typically lasting less than 5 minutes, and involves only a small needle prick. Sometimes, for a more precise measurement, the blood may be taken from an artery, such as those in the wrist, arm, or groin, which can be more uncomfortable and may require local numbing medicine. For newborns, the test is even simpler. A few drops of blood are collected from the baby's heel using a tiny needle. Preparing for the test is straightforward but important. Your healthcare provider will give you specific instructions based on your medical situation. Common recommendations include not smoking for several hours before the test, avoiding strenuous exercise and alcohol, and possibly fasting for a few hours. In some cases, you may be advised to temporarily stop certain medications, like diuretics or opioid painkillers. But never do so without consulting your provider. Babies do not require any special preparation before their test. The risks associated with the ammonia levels test are minimal. As with any blood draw, there may be slight discomfort, a little bruising, or rarely, infection at the site where the needle was inserted. When blood is drawn from an artery, the process can be a bit more painful and may require extra care afterwards, such as keeping the area bandaged and avoiding heavy lifting for a day. After your sample is collected, it is sent to a laboratory where specialists measure the ammonia concentration. Your healthcare provider will interpret the results based on your age, symptoms, and medical history. Elevated ammonia levels signal a need for further investigation and, often, urgent treatment to prevent serious neurological complications. The ammonia levels test is a powerful tool for early detection and management of disorders that might otherwise go unnoticed until they cause severe harm. Whether you're experiencing unexplained symptoms, have a family history of genetic conditions, or are being monitored for liver or kidney disease, this test could be the key to understanding and safeguarding your brain and overall health. If you found this information helpful and want to stay informed about crucial health topics, please like, share this video, and subscribe to the MediByte channel. Join us for more expert content and take proactive steps toward a healthier future.